Tyson, type 1 diabetes, we know that there are certain people who are considered at higher risk should they get COVID. And that really is something that I want to talk about right away. We go right to the biological domain, because that's really part of what we're going to be focusing on tonight. So what do you know about that? Why is it so much worse?
Well, anytime a diabetic is fighting an illness, the body's response is, it could be different for everybody, but most of the time your blood sugars go up when your body's fighting something. It's a stressor. They actually say that a stressor sometimes is a reason that a lot of diabetics actually, get the diagnosis because some kind of stressor attacks the body. So in any case, like flu, cold, you name it, a type 1 diabetic in particular, sometimes a type 2 probably will see their blood sugars rise over time, with no idea why. And it could be an infection, it could be an illness, and so the reason like COVID is very scary is because they don't know how to treat it, and or the way they are treating it is with like steroids. So like a lot of people get cortisone shots. So a cortisone shot is a steroid, and it's used to help reduce inflammation in an injured area. That screws up a diabetic's blood sugars, and it's temporary.
Right.
It screws it up where they have trouble getting it down below a certain number. And over a long period of time, if those numbers don't come down, then it starts to screw up all the organs in the body, because they need the energy and they need the sugar to be released. And so before long, certain organs will start shutting down. Like one of the long-term complications for a diabetic is organ failure, kidneys, heart disease. Actually, sometimes is the cause of death for some diabetics, because again, it's the same thing. Like over a long period of time, higher blood sugars, they start to affect the organs a little differently. So I think with COVID now, I don't know if we're more susceptible to getting COVID per se, even though we have a weaker immune system. Once a diabetic gets it, the care of the COVID is important, because if they're going into the hospital and the treatment right now is for COVID is those steroids, that's going to increase their blood sugars.
Right.
And if they don't get the right care from a diabetes perspective, like controlling the blood sugars, then you run into some complications, because you basically need to get those numbers down. And I think that's the scary part.
That's so well explained, because it's similar to the cortisol response, which is a stress hormone that
Right.
under acute and then chronic stress, one of the things the body does is suppress insulin in the rest of the body, so the brain can get a little bit more sugar and a little bit more energy. And that does, stress put people at risk for type 2 diabetes,
Yep.
but it's the same sort of mechanism. So that's really interesting.
So I mean, I talked to my diabetes educator, way back. I think I went back to see her, and it might have been I can't remember when doctor's office started seeing patients again, June or July. And we talked about it, and she tried not to be too bleak about it, but my plan was to make sure that my wife and knew what the best course of action would be. Should I have to have it bad enough where I go to the hospital, is to contact my immediate care team. That's my endocrinologist at Joslin, my diabetes educator at South Shore Medical, my doctor at South Shore Medical. Just because if I can imagine going into the hospital and you have a random doctor that's caring for you and trying to do whatever they can to keep you healthy, but if they don't know your history, who knows what will happen. So I talked to my educator, I talked to my wife, I said, these are the people that need to be contacted if I get sick. Like they need to be, and I know South Shore Hospital and South Shore Health are all the same thing. So the likelihood of them being involved was probably higher anyway, but that's really all you can do, is you can make sure your team is getting contacted.
Stretch the cat.